Hunter was initially diagnosed, and Dr. Duffner told us that there was no cure and no treatment, and that we should just take him home, and that he would probably not live to see his second birthday. Of course, we were devastated in every way that you can be devastated as a parent when you get that news. And then realizing that there was no one anywhere doing anything for the disease. Parents were our resource as far as what to do, who to ask questions, but there was no bigger network. There was no doctor that you could talk to. There was no group of scientists or researchers or anyone doing anything to help children like Hunter. It was so difficult not having anyone to turn to and anyone to talk to regarding Hunter's everyday care, because we were just going on, you know, well, what do we do now? And if there's so many things that if we would have known in advance, Hunter's quality of life would have been dramatically different.
Yeah, we were lost.
We were lost. Yeah, big time.
And pain-wise, that to me probably, you know, people talk about cures for a lot of different things, but for us, if we would have known what medicines to give him so he wouldn't have to suffer so much, especially early on when we had no clue what he had. And then all of a sudden, when he was diagnosed, as Joe said, we had no clue where to go, who to talk to, what to do. And then just seeing a little boy suffer the way he did, we're like, what can we do? And that's when we both decided, you know, we got to do something. We got to find a way so the kids down the road don't have to go through what Hunter went through. And because we knew all the stuff that we were going to do with our foundation probably wouldn't benefit Hunter, but it was going to benefit other kids.
Dylan was born perfectly beautiful, happy baby. He wasn't fussy or anything. He was absolutely perfect until he was 6 months old. We made a call to the pediatrician, and once they, you know, started using the word regression, they got Vanderbilt involved, and Vanderbilt's genetics department, and they ran through a bunch of tests, and we really, with each one that came back, we were grateful, thinking because they were all negative. We thought, okay, good, it's negative. It's good, it's negative. And it was on October 4th. I'll never forget driving him from Vanderbilt that day.
It was a beautiful sunny day, you know.
And our life had just been wrecked, you know, and it was beautiful and sunny and looked normal, and everybody was just going on and going out to lunch, and we thought, how can this be? Our life just ended as we knew it.
It was difficult, and sometimes it was difficult because of the way people would look at your child. But it was important to us to not miss out on our other kids' lives. And it was important for us that Dylan had experiences other than sitting in our house.
Every little thing you had to create for yourself, for your child's care. And it was really hard. And we didn't want to be on the internet figuring that out. We wanted to be with our child and with our other children also, you know, doing life and creating memories.
We missed things that could have made him comfortable because there wasn't someone saying, hey, by the way, Dylan's legs were really tight, and so it was hard to change his pants, right? I mean, if you picture, you know, your legs being contracted. And so we didn't have someone who was saying, hey, by the way, if this happens, here are some potential treatments to help with that. And we just found out years into his life that they'd used Botox to inject into the muscles in the back of the legs that would allow his legs to relax more, and he could be more comfortable, and we could actually change his pants without him screaming. And it's like, we didn't find that out from a doctor. We found that out from some other parent, you know, and we could have used that years before we were able to use that.
I think the biggest thing I've learned from spending time with the families is that their child's life is as valuable to them with the leukodystrophy as it would have been without the leukodystrophy, and that their child is alive and needs treatment regardless of what their prognosis is, and that their child needs dignity and respect as they go through that, and also that they just need information, that having information, even if it's not complete, is better than not having any information at all. You know, I really view caring for a family as a partnership with them, as opposed to I'm the doctor and they're the patient. Because there are a lot of things they know about their child that I can't know because I don't spend enough time with them. And I really think their information is really important and valuable. I think the LCN is really important for many, many reasons. I think one is to raise awareness amongst physicians and caretakers about leukodystrophies. I mean, the average pediatrician will not see a child with Krabbe in their life. So when they do encounter a child with Krabbe, they don't know what to do. It's just not part of what's in their database. And they need help, and most of them completely willing to accept help. They just don't know where to go.
In the past, care for children with leukodystrophies was very fragmented. They would get a diagnosis at one center and then have to go home and try to navigate the care that their child would need, with nobody really providing, the groundwork to do that and overseeing that care. The importance of the LCN is going to be, one, to provide a medical home for all of these families, but then to also to educate new providers and providers at existing centers to really work collaboratively together. It's not about doing it on your own. Nobody can treat these diseases on their own. It takes a team.
One of the most rewarding things for me about the Leukodystrophy Care Network is actually not treatments or standards of care or any of that. It's actually seeing the families come together and support each other with a variety of different leukodystrophies, not just Krabbe or adrenal leukodystrophy, but the families know what each other is going through and offers their own advice, often sometimes educating the physicians or the medical team about things that worked for other children. And they become experts in their own child to work with the medical experts to come up with a plan. I think it's just heartbreaking when a family is told or hears, go home, love your child, and just watch them die. Like, that's not the approach we take with anything else in medicine. So I don't know why it's okay to tell these families that that's their future. Instead, the Leukodystrophy Care Network creates this incredible program of some of the brightest scientists and hopefully some of the warmest clinicians to really care for that child, maximize their function, their quality of life, and really enable the gift of childhood to shine through that individual.
The Leukodystrophy Care Network is going to revolutionize not just the lives of leukodystrophy patients, but their entire families. The whole family is affected. And so the child is going to be able to be taken to one regional place where they can see a team of experts that before this have just been out there somewhere but not together, and they didn't have the right expertise, they didn't have the right specific enough training to what does a leukodystrophy patient need and what does the family need in order to be able to translate that at home. We're all very capable and we're all highly motivated. But we can go to one place and get all those services, and it's going to be amazing, not just for the child, but for the family to not have to struggle and to worry and to recreate the wheel and to spend the time and the opportunity cost of the time that they didn't spend, with their sick child, or in the time that they didn't spend with their other children. So it is just going to be a godsend in the lives of these families, and we're so grateful to be involved. We are the families of a child with a leukodystrophy. We are our child's advocate. We challenge you to see us, to hear us, to help us. We're afraid and hopeful and sad and brave, and we love this child with everything in us. The goals for many of our children have changed. We're no longer dreaming of sports and college and weddings. Those dreams have been dashed by the devastating diagnosis of leukodystrophy. We don't want our child to have pain, to die young, to be stared at, ignored, or forgotten. We want our child to live, to play, to enjoy, and receive love from other people. The medical decisions we make are with those goals in mind. Our children are more than their disease. They're more than their limitations. Our child has potential. Our child has impact on the world around them. Our child has love to give and love to receive and life to live. And our child is worthy. Our child is worthy of our best love and our best efforts and yours. We invite you to partner with us on this journey, however short or long it may be, to do our best for our child. We challenge you to see what can be for our child, not what never will be. We want the best for our child, the best life, the best love, the best care, and we need your help to get there.